Welcome, friends. We have an exciting episode for you today. We have a special guest, Cheryl, in the house, who is the founder of a pretty incredible and innovative company called Tiny Health that has done some pretty amazing things when it comes to innovation in the microbiome testing space. And of course, we love testing. We love data at Green City. And so, of course, Dr. Taylor wanted to get her on the show to take a deep dive into everything that you need to know about microbiome testing and how it relates to your gut health and your dental health. Welcome, everybody. Cheryl, Dr. T, welcome to the show.
Hi, thanks for having me on the show.
Yes.
Thanks for being on the show. I'm really excited for this episode because gut health is so important. I think it comes up in almost every podcast that we do. And it's something that I talk with patients a lot about. And I actually found Cheryl's company, Tiny Health, when I was pregnant and had my daughter. And so I did her Tiny Health test on my daughter, Quinn, when she was just 10 days old. Because going in with all the stuff that I know, I was like, okay, I got this window here to maximize this gut microbiome, and I can influence it. And so anyways, I continued to do the Tiny Health test and change some things with for your recommendation, Cheryl. So anyways, I'm excited because the mouth and the gut are all one tube. It's all connected together. And what happens in the mouth, especially when it comes to cavities and periodontal disease, a lot of those things are actually linked with the microbiome that's going on. So anyways, Cheryl, can you tell us a little bit more about Tiny Health and what inspired you and how it got started?
Yeah, for sure. So I also got inspired to start the company from my own experiences being pregnant. And for my first child, I think it was the second trimester, my OBGYN prescribed some antibiotics from a urine test that tested a little bit high in bacteria. I actually didn't have any UTI yet at the time, but I was in my first child. I didn't know. I just listened. So I kind of did it. But then I actually got UTI from that antibiotics, because then now knowing what I know, it destroyed not just my bad bacteria, but also my good bacteria. And it could also destroy not just the gut bacteria, but also the vaginal microbiome bacteria. So anyway, they then switched me on a higher dose. And that was what really prompted me to research on my own in terms of gut health during pregnancy. And how is it important to baby? Does it transfer to baby? And so then later on, I found out my daughter was breached. This is my first child, and that I could be faced with a C-section. So I really, really deep dived into sort of the colonization process at birth. And I learned that the baby is pretty sterile in the womb. They don't have a microbiome in the womb. So they get their first colonization through the birthing process, through labor. So first they get the vaginal microbes of the mom, seeding baby's gut. And then some fecal fluid during labor, which is actually healthy, colonizes, baby swallowing all the fluids coming out, and that's colonizing their guts. And then post-birth, the lactation process, breastfeeding, the mom is continuing to transfer her gut bacteria through her breast milk, which is magical. And scientists don't know the exact mechanism of how that happens yet, but we do know there's a transfer. So birthing mode, C-section versus vaginal birth, is one way for babies to get mom's microbes. And the more of mom's good microbes that seeds baby at birth, the better it is. But even with a C-section, you can really turn a baby's gut around through prolonged breastfeeding. So anyway, that's all to say. I had a personal journey for why I started researching gut health. And the other kind of key thing that I learned is how these bacteria colonizing infants' gut at birth and in the first few months of life is so crucial to their immune training, their immune development. I learned that C-section babies have a higher risk of eczema, asthma, allergies, and hay fever as an adult, which is this kind of progression of allergic disease called atopic March. And all these are all basically a sign that the baby's immune system wasn't set up correctly at birth and not trained by the right combination of bacteria. So when I found out about this, I was like, oh no, I had a C-section. What do I do? I can't change that fact, right? But there are a lot of things there are a lot of ways you can intervene and course correct early on if there are major imbalances. So then fast forward, I was pregnant with my son, and I was already at that point researching so much about gut health, and there's no test for infants or moms at that point. So I finally had a VBAC at home with my son. And I started the company a week after he was born because I really wanted to test his gut and, sort of like catch any imbalances early on if he had some, because my daughter ended up getting some eczema and food sensitivities to gluten and dairy and constipation and all that. And then now my son, he doesn't have all the same symptoms and conditions his older sister has. But I started Tiny Health to really bring the science of infant gut health, maternal infant gut health, to a lot of parents like me.
That's awesome. Thank you. I benefited from that. So that's so awesome. That's a great story. I feel like so many people get inspired by just like their own life experiences. And I don't know, having kids for me also made light bulbs go on. You're like, we got to fix this next generation. It's pretty scary watching kids and how sick a lot of kids are these days.
The CDC says almost 1 in 2 kids have a chronic condition today, right? And that is crazy. If you think about it, the new normal isn't normal. It should not be accepted by us.
Well,
right?
And that's the problem, is that a lot of babies, even in reading more natural stuff and all that, it's like, oh yeah, babies can get some eczema, like no big deal. And you're like, okay, but that's a sign that there's something else maybe actually going on. And if you can catch it early, I love being preventative. So it's like, if we can catch something early and have minimal intervention and get back on track, why would you wait until there's all these symptoms? And okay, what if that eczema doesn't go away? What if it turns into something else? And I think that a lot of people, I see this when it comes to like tonsils being enlarged with airway and breathing. A lot of doctors are like, maybe they'll just grow out of it. But it's like when you have a baby or a toddler, there is so much preventative stuff that you can do. If you wait to see if they'll grow out of something, they're probably not going to. And also, I feel like a lot of parents and doctors are like, oh, probiotic. What I love about your company is that you're like, hey, not everybody needs a probiotic. And this probiotic doesn't work the same as this probiotic. And we have to look at what we're actually treating. Right? And it's not always one size fits all.
Yeah. And back to the early symptoms. If you have a baby that is colicky, not even the medical colic diagnoses, but if they're crying a lot and they're not sleeping well, they're not napping well, I think you should check in, because babies can't communicate with you, right? All they can do is cry, and babies aren't supposed to cry for no reason. When they're crying, they're either hungry or tired, sleepy, or there's something off about discomfort and things like that. And oftentimes we do get the answers in their gut. So I agree with you, and I'm all about being proactive as well. Sometimes we do see a lot of parents just kind of like only taking action when there's a symptom in their kid, which makes sense. Our test is not a cheap test. I would just encourage at the first sign of something that you feel isn't normal to check in their gut, because there is a window, the critical window of immune training, as I mentioned earlier, that is easier to course correct the earlier you test. And I would say breast milk, or specifically the human milk oligosaccharides, or HMOs, in breast milk. So HMOs make up a third of breast milk. That is the essential ingredient to modify a baby's microbiome if they're missing certain beneficial bacteria.
So how long would you say? So I know a lot of moms choose to go the formula route, or they just breastfeed for a few months. They get to that 6-month mark and then they're like, great, foods, I'm done. What would you say? How do we best set babies up that are formula fed, or that maybe moms are like, it's not realistic, I'm not going to be breastfeeding? Do you have any suggestions?
Yeah, for sure. We also have suggestions in our results. If you do choose formula, there are more gut supportive formula that has the prebiotics added. So the HMOs that I talked about, some formulas have started adding them in quantities that are nowhere near the amount found in breast milk. There are supplement companies starting to come up with HMO supplements. So that is one of the key ingredients we also recommend if you are formula feeding and your baby needs a probiotic, a beneficial bacteria that they're missing in their guts, then adding that prebiotic, that HMO supplement, or a formula with HMO supplement would really help that bacteria colonize. Because, if you think about an infant gut, they're sterile in the womb. I mentioned they get their first flush of microbes when they come out. So if you think of the baby's gut like an island, there's maybe just 10 maybe coconut trees being planted there, and that's it. And over time, the variety and the volume of coconut trees and the vegetation and perhaps the biodiversity, not just like the coconut trees, but like animals and insects that live there, really grow, especially with solids, right? So early on, if the wrong trees were planted, maybe they were weeds instead of coconut trees, so to speak, it's easier to uproot them and replace them with the right combination of tree, the one with good species, right? So the prebiotics are really the ingredient to feed them, to keep them there. So they're the food to the probiotics, the beneficial bacteria. And so 6 months and between 6 to 9 months is another turning point when you are introducing allergens and solids. So that's where you double the amount of trees and vegetation and biodiversity and animal life on that island. And by the time the child is about 3 years old, it's a very mature island with biodiversity and ecosystem that's like pretty much adult-like. Mm-hmm. So that immune training window is really guided by what species of coconut trees and what animals are initially on that island. And so you really want to make sure that maturation is mapped correctly and course correct any imbalances to prevent chronic conditions. So post 3 years old doesn't mean you can't change a child's microbiome. It's just harder. If you can imagine, the roots are deeper at that point. It's harder to uproot them, replace them with new vegetation and whatnot. Like you and I, we can still modify our microbiomes for sure. It just takes more work, more dedication and discipline to have dietary actions or supplement actions that are just like you need to do it for 3 to 6 months, for example, versus in an infant, you can course correct in a matter of weeks, maybe 2 to 3 weeks.
Wow, that's amazing. I've had a few friends who have babies similar to my daughter's age, and some of those babies have been on antibiotics. Once, I think maybe 2 or 3 times. And I don't think any of the medical community, maybe I'm wrong, I hope I'm wrong, but it doesn't feel like a lot of the medical community is really making recommendations to test the gut and make sure that we are taking that, we have that window, right, up to 3 years where you have the most influence and the most impact.
Yeah. And I want to comment on that too, because antibiotics in early life are very commonly given for ear infections, right? Mm-hmm. Look at how many kids get ear infection the first, second year. And most ear infections are actually viral, not bacterial. So they're being overprescribed. And I always tell people, or we have a full guide on if your child has ear infections, do ask your doctor if it's viral or bacterial. If this is needed, can you wait? I believe the AAP even recommends waiting out 72 hours, which for some reason, most doctors, even from a personal experience, they don't tell you to wait 72 hours. It's just given, right? So I think there are moments for sure that when antibiotics is needed and life-saving and really helps. But I think as a society, we're just overprescribing them. And then, like you said, not taking care to restore what is then destroyed, right? Because again, antibiotics destroys not just bad bacteria, but also good bacteria. And remember I said the island, when the baby's born, they only have maybe 10 trees. And you'd want 9 out of 10 of those trees to be this specific species called bifidobacteria. And this is a probiotic. It's very commonly found in a store, but the different strains do function for different reasons. So you need to get strain specific. Strains are basically beyond the species name, like Bifidobacteria infantis. it's the letters and numbers behind the species. So if you pick up a bottle of probiotics, they should have letters and numbers behind it. Otherwise, I wouldn't even get that probiotic formulation, because strain is where it's scientifically backed to help with different functions and different indications. So in infants, we want 4 specific species that can digest the HMOs in breast milk really efficiently. And 9 out of 10 of those trees should be a bifidobacteria species. So this is what trains their immune system and prevents pathogenic bacteria like E. coli, Klebsiella, Salmonella, and all those things from colonizing. Because when we see babies with a lot of symptoms, colicky symptoms, eczema, food allergies, cow's milk protein allergy, they are usually deficient of bifidobacteria. They have 0 beneficial bacteria, or maybe 1 out of the 10 trees are bifidobacteria, and the rest of the 9 trees are like the E. coli type bacteria. So it may seem very shocking to some parents when they get results back. What? I'm breastfeeding. My baby was vaginally born. Why is my child's guts so bad? And when we do have mom's gut sample, mom is completely deficient of bifidobacteria as well. And so that was my case. When I had my son through the vaginal birth, I tested my gut during pregnancy and my vaginal microbiome too. And I learned at that point where I had no bifidobacteria myself. And coming back to the antibiotic discussion, bifidobacteria, that beneficial bacteria, is very sensitive to antibiotics. So it can get depleted with just 1 course of antibiotics. If you're not taking care to restore it through a pre and probiotic, then it may never come back. And so if you are pregnant and giving birth, even vaginally, even with a vaginal birth and breastfeeding, if you don't have it, then you're not passing it on, right? Mm-hmm. That said, dads have a role to play too. Dads can transfer to baby. Older siblings can as well. So we've seen when mom is depleted, but somehow dad tested too, or older siblings test, they're kissing and in the same household, they do pass it on. When we see baby by 6 months or 3 to 6 months having 0 bifidobacteria, that probably is a sign that nobody in the family has any bifs, right? Because we're all maybe depleted for different reasons, medication, poor diet, whatever reason. Sometimes it's like we get a lot of parents trying to improve their infant's gut health or their child's gut health. We always kind of like, well, you should also look into your own gut health, because eventually your kids are eating what you're eating, putting on a table. They're living in the same environment, breathing the same air, getting exposed to nature or pets just as much as you do. It's a family effort and it's a lifestyle. It's not just one point in time. It's a lifelong thing.
Yes. And you will feel better too if you have a better gut microbiome, not just about babies, right? Because the gut is just so important for so many health things. I think we don't give it enough credit. So it's funny because, Cheryl, I did tiny health tests on my daughter when she was 10 days old, and the results came back. And you get like a report with different recommendations and action steps that you can do. And one of the funny things that I thought was that, because I did all the testing during pregnancy, I was like, I need to make sure that the microbiome is set up. And your report came back to me and it said, your baby's gut has too many good bacteria. You need some bad stuff. And so I think it's so funny because we need to train. We have to train our immune systems too, right? So it's good to have all the good stuff there to be supportive, but then we live in such a sterile world. And when you live in a sterile world with all good bacteria, that doesn't train your body to know what to do when something maybe bad comes along. So your recommendation was she should probably be in the dirt more. You should probably get around pets more, let her lick the floor, just those types of things. And so anyways, I got a little bit less nervous when you're a first time mom and you have that newborn baby and you're like, I just don't want anyone touching them. They're so vulnerable. And so after I did that test and she was 10 days old, I was like, interesting. So I would let her like pet the dog, and I didn't become so crazy about creating that sterile environment. And so I did a follow-up test, I think a month or 2 later, and she had more of the bad stuff, which was in this case.
Yeah, I wouldn't, like at 10 days old, I wouldn't be so aggressive at exposing them to so much outside environmental thing, especially if they are deficient of BIFs. So it sounds like your daughter had them, which is good. And that's what protects your immune system. And if they have sufficient BIFs, and this is really the key in the first year, then I would feel more comfortable exposing them to nature. Because if you think about it, how we grew up in the past, right? Our ancestors, we grew up in a community. We were constantly, when babies arrive, they're being passed around and they're acquiring all these healthy microbes from their family members. And we used to also spend 90% of our time outdoors with sunshine and on the farm. And now it's the opposite. We're spending 90% of our time indoors in, like you said, a sterile environment. We sanitize everything. Well, we don't sanitize. We are used to post-COVID clean everything, and especially when it comes to babies, right? So that is actually, there are studies being done where in a city kind of environment without pets in nature, you do have a higher incidence of household of allergies, right? And if you do have a pet at home, there are less allergies in kids. And it's because your dogs and cats are going outside, bringing the dirt in. So they're bringing the nature in to your home and diversifying your gut. So it is important. Sometimes when parents see our recommendation to take their kids outside, like in nature, it may sound generic, but really, truly, that's probably what your child needs. And it's specific to their results.
Yeah, that's I think for me, it just made me feel a little bit more relaxed about the dog licking Quinn's face or something, or something fell on the floor. I was like, it's okay. And then I continued to test, right? And I also loved how in your report, like one of the reports I did, they said, there's a little bit more of this we'd like to see. Some cinnamon and garlic can be helpful to just incorporate more into the diet. And so I started cutting up little pieces of raw garlic and putting them in raspberries and doing cinnamon and yogurt and then retested, and that fixed it. It was just like such a simple thing to do. You just don't know what you need to do unless you test, right?
Spices can be very powerful if your kid have higher than normal usual levels of pathogenic bacteria. And cinnamon is the one that usually hits the mark on many different species. We have this, I'm sure you've seen a spice chart of what spices are to target specific microbes, right? So strep, you'll have different lists, staph and E. coli and salmonella, you'll have a different list. But cinnamon is the one that kind of hits a lot of different pathogenic bacteria. And garlic, ginger, all those kind of like onions and things like that are always healthy to add to the diet as well, because they are also antimicrobial. That is very specific to pathogenic bacteria.
Mm-hmm. Yeah.
Cheryl, I have a question. So it looks like, because we've talked through what's going on in those kind of critical windows, just take us through maybe part of how the program works. So I'm sure everybody gets at this point, there's a test that you take at home and you send that test in and then you get results back. And it looks like the way that Tiny Health is set up is there's a couple different models. There's a one-time type thing a person could do just to get testing and get the report. And then it looks like there's an ongoing program almost that you offer that allows for testing and changes over time with a variety of different resources and support systems. That sounds really, really cool. So I would love to hear a little bit about what that system and process looks like after you take the test.
Yes, thank you for asking. So in case parents don't know, actually, the at-home test is a stool test. In case you're wondering, how do you find out about your gut bacteria? We still get some questions. Is it a blood test? Is it like a urine test? Like, it's a stool test. And it's a swab that looks like a Q-tip. And it's very easy. You're just taking a very small stool sample directly from a diaper. If you still have an infant or a toddler, if you're wiping, and you can just sample directly from a toilet paper. It is that easy. And then you send it to our lab, and within a few weeks, you get results back. And so I would recommend, frankly, if you have young kids under 3, and even for adults, frankly, I would recommend a minimum of 2 tests. Because if you're getting the first test, I would call that your baseline test. And everyone should do a baseline test to see the state of their gut. And we use a technology called shotgun sequencing, where it's next-gen sequencing. We measure everything in your gut, all the bacteria, fungi, if you have any, parasites, if you have any, viruses, archaea. So we see everything in your gut. And not just what's in your gut, but what other functions in your gut. So what are the bacteria doing? Are they functioning as intended? So we typically would recommend a Tiny Plus member, which is an annual membership. You get 2 tests upfront with 1 consult call with one of our microbiome specialists. It's a 30-minute call to walk you through your results. So I think for anyone who's kind of maybe you don't have a specific issue, you're just being proactive or wanting to optimize your gut health because you know that 80% of your immune system is in your gut. And it's so crucial to just overall health, right? I would recommend the membership. We have a family membership, and you can use the 2 tests for any family member. And then you get additional tests for $169 per test. So it's a cheaper rate to test multiple family members over time. Now, that's if you are, again, proactive and you don't have any specific concerns. If you actually have a baby with eczema concerns, cow's milk protein allergy, colicky symptoms, or you had a C-section and you think there may be recovery there that needs to happen, then I would suggest you do a program. And basically, a program is just targeted at that specific problem. So you'd still do 2 tests, 1 baseline test, and then you would have a retest after a few months. And you can complete a program within a year. And technically, within that year, there's 4 calls with our microbiome specialists as well. We prefer to do a first onboarding call to just walk through your child's symptoms and what's up. And there are already some things you can do before the test. Then while you send the sample in and you get your results back, then you do your second call to walk through your results and what actions you need to take next. And then you do your third call as a check-in to follow up. Sometimes certain probiotics don't really work and you need to swap or you need to stop. There is a danger of over-supplementing with the probiotic that may inhibit natural diversification. So you may not want to, especially if you're dealing with infants, you may not want to supplement you may not want to over-supplement. And then you do your second test. And then the fourth call is to walk through that retest. And then you can always add on more calls if you need more help. And we are here to make our product accessible and affordable for families. Because if you book a functional medicine, you mentioned some of your parents are already working with a naturopath or a practitioner, which is great. And we actually have a practitioner program too. We can work with their practitioner in how to interpret the report and work with them. Because we really want to, ideally train the trainers and help them be able to read this for their patients as well. But we also have a program for people who aren't working with existing practitioners at a very affordable rate, because sometimes it can take months to get a consult with your practitioner. And with us, we try to make it not more than a couple of weeks.
That's awesome.
I love it. Yeah, no, I thought there was just such a variety of different programs that you have. And I think the other cool thing is that this is applicable. Obviously, our big orientation on today's show, we're talking a lot about baby health and mom gut health, but yeah, whole family health. And it looks like you have an optimized program for people who really just want to take their overall functionality to the next level. And for people who have chronic conditions, I have so many friends actually that I was like, they need to know about Tiny Health because they have these chronic issues, SIBO, different other chronic issues with their gut health. And I was like, this type of approach I love because it happens over time. And so many things when it comes to figuring out what that right combination of actions, lifestyle, supplements, foods, it's not like you take one test, you do one thing, and then you fix this gut health issue that's been building your entire life. You need to approach it with a little bit more of a let's trial and error, and let's measure multiple times and make adjustments and then see how things are improving, and looking at what the results are telling us and that data, because each person is individual, right? They are a little bit different. Not everybody responds the same way. So I think it's a really cool program.
You really nailed it. Sometimes people think, oh, your test is going to be the magic bullet that solves all our problems, or especially adults who have like chronic conditions for a long time. The gut microbiome is a big component, but only one piece of the puzzle, right? There are genetic factors, environmental factors. You got to look at holistically your sleep hygiene and diet hygiene. And there's so many factors. If you don't fix some upstream factors, then whatever you change in your gut is probably not going to sustain itself, right? It's probably not going to be as effective. So some of I think when we have more adult users or customers during programs, it tends to be a bit more complex. And ideally, they are working also with a functional provider, and we really help them deep dive in the gut microbiome component. We do holistically try to guide them as well. But for when it comes to kids, it is much easier because again, their habits have been formed that you are the parent cooking for them and inculcating good habits, dietary habits. There's a lot of opportunity to really, like you said, Dr. Taylor, like prevent and course correct and even reverse chronic conditions if you do have them with better habits, right? And a lot of it is education on nutrition, supplements, and lifestyle changes.
Yeah, and I think just a lot of people just don't even know. Like there are so many kids that I know that have eczema and parents struggle with it, and they have all these creams and all of these different things that they get prescribed, and it's just like, there's a test for that. I'm always like, okay, but I know that you have that, but why do we have that? Why do you think your child has eczema? Why do you think that this? Why? There's always a why, right? And you have to push, and it's awesome that you guys have that as a resource. And yeah, I think that this is just such a PSA for parents and women that are pregnant too. I think moms don't realize how important dialing in your own microbiome and your own gut health is, because that will impact your baby. And that, like you talked about how important that immune system is. 80% of our immune system is in the gut. And we live in with this, we have a very strong relationship with the bacteria that live in our gut. They should be working for us and with us. And that directly is going to impact the way that we absorb our nutrients and how our immune system functions. So yeah, again, it goes back to that prevention. And Barry, we talk about this a lot. Prevention starts preconception and just setting that stage from day negative. So
yeah. The first 1,000 days, which you might have heard of a lot, starts in conception, actually, right? So mom's gut functions actually influences the child quite a lot. There are a couple of studies showing that mom's butyrate function, it's a short-chain fatty acid, so it's important for your gut lining and gut barrier integrity, so you don't get leaky gut. So mom's butyrate function, which we can measure with a pregnancy test or a TTC test, can influence your child's externalization behavior, their mental health by year 1 and 2. Your diet and your gut function during pregnancy is so crucial, in addition to what you may or may not be passing on to your child at birth and during the breastfeeding period. So I cannot emphasize this enough. And you mentioned that the whole prevention thing is, frankly, don't wait until your child has symptoms to test, right? Because if you can prevent and catch those imbalances early on, it is so much better than prevention. And your child's microbiome in the first 6 months does change very rapidly. So I would say I would do what you did, the 10-day sample, to see what seeded baby at birth. And then about 2 to 3 months, you would see the full impact of breast milk coming in already by that time. If you are breastfeeding or if you're formula feeding, then you would also see that impact. And you would know if there are certain deficiencies, then I would really recommend at that point 2 to 3 months for mom to check in her gut too. But there's, again, never too early. It's never too early to check in anyone's gut, to be frank. But I'm just considering it's a factor of affordability, right? How many tests can you buy? And if you wanted to optimize when you should. If you have an affordability issue, skip the 10-day test and do this 2 to 3 month test, 2 or 3 month test to see what has come in from breastfeeding and things like that.
Mm-hmm.
And then 6 months as well to follow up. And then another time at 9 or 12 months, depending on, again, affordability. But in that first year, frankly, I would test 3 to 4 times
Mm-hmm.
because you want to make sure that there's the right balance of microbes. Like you said, there could be too much of a good thing and not enough of a bad thing to train their immune system. That's crucial too. So you want to check in to make sure that. And then beyond 1 year, frankly, twice a year to maintain and check in would be good. Like, again, the antibiotic issue. So if you have a baseline test before antibiotic exposure, and if you do need it for medical reasons, then sure, give it to your child. But then you know what is missing after antibiotics, right? So we typically say wait 4 weeks before you retest post-antibiotic treatment to then see how much it's changed from the baseline. And hopefully, yeah, you had that baseline test before antibiotics treatment. And then our consultants can help you sort of like strategize what you can give your baby to restore to the original state. Because again, restoration is not really being focused on in our community post antibiotics. So I would say post 1 year, if you have antibiotic, if you're giving your child antibiotics, if there's a major diet change, weaning, changing formula, entering daycare is another component. You're getting a lot of kids in that daycare, and a lot of kids get sick, right? So I would say check in then as well to see how you can support their immune system at that point. We moved from California to Texas, and our whole gut health, our whole family's gut health got worse because we weren't sourcing foods the same way we did at farmers market in California. So I had to resource all my food supply here and filter our water because our water in Austin was so bad. It had arsenic, lead, and uranium in it. So we really had to, again, you don't catch these things until you test, right? And we had skin symptoms when we moved here.
Wow.
So there are many reasons why I would say proactively test twice a year.
Yeah, even now I like to do a gut test on myself. It's just so important. It's just very preventative. Okay, I want to talk about a few more things. You mentioned arsenic, and I also, when I got my report back, you guys make some just kind of general recommendations. And one of them is not to do rice cereals because rice has high amounts of arsenic. So can you talk a little bit about that? I think a lot of parents, the rice cereals are their go-to, but how would that rice and other foods that are being introduced like that, how would that impact the gut?
Rice isn't even, if you look at the science, and I know you kind of like did your nutrition research and are off the Western Price Foundation kind of philosophy. Rice isn't even the best first nutrition for baby, right? Whole first foods being rice cereal is not what we would recommend. Definitely not carbs. We're on the high protein, high healthy fat track.
Mm-hmm.
And there are even certain foods like citrus that you shouldn't be feeding your kid in the first year because their digestion system isn't able to digest that, right? There are certain vegetables that you shouldn't feed your child in the first year. But you want that first diet to reflect the breast milk composition, which is a lot of fat and a lot of protein, right? And so that's what I did. We did a lot of liver and avocado. I don't think I ever fed rice cereals. So in addition to the arsenic in rice, which is an issue, heavy metals in general in baby food is an issue. So even purees that you buy from the store, even some organic brands, I can't even keep up with all the reports coming up, but I would advocate for you as a parent to research everything. Frankly, I'm that mom who researches everything and advocate for my own health. Mm-hmm. I still see doctors, and I have a functional medicine practitioner. I see my kids see a holistic doctor, but I research everything myself. And so brands that you're feeding your kids, there are consumer advocacy groups that check in like metal, lead levels and these foods. I would check in before feeding your kid.
Yeah, the baby food, if you just go to the grocery store and read the labels of, everything is packaged and it's gross. That's what we're feeding our kids. It's just this, they have like the little puffs or like the little like they're basically all carbs and sugar. And yeah, I'm with you.
And additives.
And additives.
Yeah.
Yeah.
Yeah. Whole foods are the best. So if you can and are able to cook your own baby food, I understand not everyone has that luxury. And occasionally we do buy snacks that are packaged, right? We can't avoid that completely.
Yeah.
But as much as you can, just cook in batches, freeze them, and kind of like let your babies eat whole natural foods that are not processed. That would be the best for their guts. I think it's funny because there's a lot of, when starting solids, a lot of baby purees that are very focused on fruits and just fruits, right? And
a lot of spinach pureed in, or they try to get the vegetable in, and you're like, I don't want the vegetable in there. I want more fat or more protein.
Yeah. I think everyone has their kind of philosophies, but I would say there is just to watch the sugar and like emulsifiers, because emulsifiers do have an impact on gut health, and especially the developing infant gut health, right? We have a whole, I think, blog post on emulsifiers, and I think even avoiding them and what are the ingredients of emulsifiers that you can find in baby food or even older kids' food. Like now I have a 4-year-old and a 6-year-old, and we do buy snacks, and we're like, I read labels like crazy and make sure nothing is added in there, no added sugar and no emulsifiers.
So do you have a favorite formula for moms who can't breastfeed?
Favorite formula? It's hard to say. I haven't personally formula fed my kids. I think I did 18 months and 2.5 years for both my kids. But I've heard good things about Serenity Kids. Their formula is for 1 year and above, so not infants. But I've heard some parents use it anyway for infants because it's a regulation thing. But again, use your own discretion. This is not medical advice.
Mm-hmm.
A lot of parents like cleaner formula like Bobby and By Heart. I think what's missing in those formula, they have cleaner ingredients, but what's missing is the prebiotic. So in those cases, if you're choosing a Bobby or By Heart, I would add an HMO supplement. So Begin Health, which is one of the company we work with, they also have a gut test that we co-brand. So it's actually a Tiny Health gut test underneath. They just came up with an infant HMO that you can add to formula, and that's groundbreaking because there's just so few infant approved HMOs. Again, just to remind your audience, HMOs are human milk oligosaccharides that make up a third of breast milk. So if you are unable or not breastfeeding and formula feeding, I would highly recommend adding that.
Okay, that's awesome. Good advice. And then we got a lot of food sensitivities happening just in the world. Seems like everybody's sensitive to something. Do you think that is linked to the microbiome and those early years? Do you think that's part of those food sensitivity? Like you had mentioned, like dairy, cow milk sensitivity. Like, can you talk a little bit about that? Is there a link, correlation?
Yeah, it's a complex topic, right? Because it's only recently where we're diagnosing more and more cow's milk protein allergy, and there's so many kind of non-IgE mediated type of food allergies. And we do see there are some biomarkers or microbiome associations with those conditions, which we have up, but they're very emerging research. I wouldn't look into them too much as predictive or anything like that. So the only kind of more predictive biomarkers we have are for eczema and asthma, are the strongest. For food allergies, that's where we need more data, and partially at Tiny Health, that's why we are collecting a lot of data and survey data about what conditions your child has and has it resolved and when, what did you do, because that will only make our data more accurate in terms of predicting, what kinds of allergies, because this is literally the condition that doesn't have a lot of consistency in microbiome research world. Mm-hmm. So there may very well be a connection And again, it comes back to the bibs. It is just crucial. So no bibs in a baby in the first year, or low bibs or the wrong kind of bibs are the source of so many symptoms and conditions in babies. So this is why, again, test early if possible in the first few weeks, in the first few months, to check in. So there may be a strong connection with the bibs, the missing bibs, that are increasingly disappearing from our society, even in adults, even in moms like you and I. We are depleted of bibs. And so that's one factor. But again, it's multifactorial. If we go into the topic of how compromised our food supply chain is, it's a whole nother podcast, right?
Yeah.
I'm sure you're aware of that. And it's our dairy is different from milk that you can find in Europe, right? The cows from Europe are A2 cows, the cows here are A1. There's that factor that maybe we can't digest the protein in the cows here anymore. So there's that factor of maybe foods being overprocessed and lacking nutrition and the foundations of our, produce, right? Like where it's coming from, monocrops and not regenerative agriculture. So even if we're eating that apple, it could have been sitting around in the supermarket for a year, right? That's actually a fact. A lot of people don't know that their apples are not fresh. How are you able to get apples all year round? It's been sitting there and kind of like just like there's a ripening system, right? And so that and the nutrients in our soil that gives us the microbiome diversity is being depleted. So there's so many factors why we're seeing more and more conditions in kids and society. I think food supply, a water supply is compromised, and it's hard, right? So we can try to fix things that are within our control and do our best for the rest. But I do think that people should be aware of the different factors that can affect their gut health, their child's gut health. And like the way I treat it is kind of like target one thing each season, because it's impossible to do everything at once. It's pretty overwhelming when you learn how compromised everything is, how many toxins there are in even like lotions and skincare products and your baby's soap, right?
And just watching your baby too. Because babies come out and then they just give them a bath immediately and it's that sterile world, right, that we're living in.
Yeah. So my advice is pick one thing each season so it's more digestible. So one quarter, pick and focus on all your cleaning supplies and changing that out, finding non-toxic brands. We recommend a lot of non-toxic brands on Tiny Health. Another season, tackle your produce or your meat supply, right? Or dairy supply. We do raw milk here from a local farm because that's what we believe is the best for our gut health and has healed my daughter's dairy intolerance. She can only do raw milk now. She can't do conventional milk. But that's just me personally.
I did raw milk with my daughter too. We still do it. The Weston Price raw milk formula for her when I breastfed her till she was 19 months old, but needed to do a little bit of supplementing just because I work. But yeah, I think raw milk is awesome. It has so many it gets really bad press, raw milk.
Yeah.
Or like, you're going to kill your child. And you're like, I'm okay.
Yeah, no, I mean, I healed my daughter's gut with it, but I think everyone has to go through their journey, right? You can't really push it on people. Totally. I think they have to discover the benefits and do their research on their own, because I
see results. When you have a symptom and then you make an intervention and then you see that symptom improves or that things get better, it's really hard to go back when you're like, oh, that was causing this. And I think but again, you have to test and you have to be open-minded, I think.
Mm-hmm. Yeah, like our latest season was actually water filtration. And that's when I made my husband do a test of our water because we all had skin conditions. that wouldn't heal. And my daughter's eczema came back and my wounds wouldn't heal. So we're like, okay, I thought we fixed our gut health. Something else is going on here. And then that's when we found the arsenic, uranium, and lead in our water. So we were filtering out drinking water with RO already, because that's the best one that can only, the only system that can filter out microplastics, which is what we really didn't want in our water, and the heavy metals. But we're bathing with unfiltered water. We now have a shower head filter and tap water with gargling when we're brushing our teeth with it. So now we have a whole house filtration plus the shower head. So we're almost double filtering everything. And we tested our water. It's all gone now. And I think our skin conditions are slowly improving.
That's awesome. There's so many. It's overwhelming, right? Especially if you're just getting into the world of becoming aware. I think a lot of people live in this world where they just don't know. They just don't know that is even a thing. And when you start to talk about it, and it's hard to be comprehensive, right? Like in our office, we talk about so many things and we go down the rabbit hole and it's people leave here after their new patient exam. They're just like, I don't even know. There's so many things we talk about, right? And so it's so overwhelming and you have to tackle it like one piece at a time and then also go back to that thing because maybe the water filter broke or the filter didn't get replaced or there's like this maintenance too that happens. Yeah.
But again, I think I found that really taking that at a pace, you can't do everything at once.
Yeah.
And don't blame yourself. I really, even with tiny health, sometimes it's like, oh no, like you're making C-section moms feel guilty or formula feeding moms feel guilty. I'm like, no. It's like we want to be a company that empowers you with data because I had a C-section and I had all these issues with my daughter, and it's about then what can you do about it? You can turn it around. And so it's all about taking baby steps even. What can you do and not blaming yourself? Like you made your decision with the best information that you had at the time, right? And so that's past. Then what can we do next, right? Let's check in. And as long as you have the intention and motivation to create a better environment and better health for your family, that's all that matters. And it's already a big step forward. If you're listening to this podcast and curious about this type of information, that's already a huge pat on your back.
Yeah, it's always about progress. It's never about perfection. And it's a journey, right? It's a journey that starts with asking a question and with trying to understand what's actually going on, what's the data telling you, and knowing that there's resources out there. There's people like you, Cheryl, and a company like Tiny Health, and there's Dr. Taylor out there who's obsessed when it comes to all of these topics as it relates to our overall health and our mouth health and our oral health and our gut health. And it's just so exciting, right? So it can be overwhelming, but equally it can be exciting in that there's a lot more options and opportunity to learn, make changes, and really create an optimized health for yourself and for your family. So Cheryl, thank you for being on the show. Thank you for sharing. Thanks for this deep dive. Dr. T, as always, thank you for your insightful questions. And I love how, again, we're really creating a great resource for newer moms and expecting moms. Just on the Your Mouth Matters show, we just tend to have a lot of topics that are really beneficial. We need to pull them all together in a guide, little book that we have for people. Because it is a missing resource, and these are questions that people should be asking, and they're not even aware that they can be asking them in many cases. So again, thank you both for shining a light on this. Thanks for taking this deep dive, and we will catch you on the next episode of Your Mouth Matters.